Welcome to The Healing Voice, Healthy Living with Newman Regional Health.
We're your hosts, Casey Hastings
and Sailor Middleton.
Each episode, we sit down with medical providers from right here in Emporia, Kansas, to explore practical tips and insights that help you live a healthier, more informed life.
But first, let's hear from the leader of Newman Regional Health herself, our CEO, Kathy Pimple.
You know, navigating all the health information out there can feel overwhelming. As someone who cares deeply about this community, I want you to have a trusted local source you can count on. This podcast brings you direct access to the experts who care for you and your families every day.
Thanks for joining us. Let's get started.
Today, we're excited to introduce you to Dr. Anna LaSota, a family medicine physician with Newman Regional Health Medical Partners right here in Emporia. We also want to celebrate that it's National Doctors Day, so happy Doctors Day.
Thank you so much.
Of course. Dr. LaSota has been caring for patients in our community for more than a decade, with a strong focus on family medicine and women's health. She's known for taking the time to really get to know her patients, not just their symptoms, so she can treat the whole person and support them through every stage of their life. When she's not in the clinic, Dr. LaSota is deeply rooted in our community, spending time with her family, cheering on local sports, and staying active here in Emporia. Joining her today is Amanda Fisher, one of the nurses who works closely alongside Dr. LaSota to support patients every day. Together, they'll share insights on staying healthy, navigating today's medical information, and why having a trusted primary care team truly matters. Welcome. We are so glad to have both of you here with us today.
Thank you so much.
Thank you.
Absolutely. For listeners who may not know you yet, can you tell us a little bit about your background and what led you into medicine and eventually to Newman Regional Health Medical Partners?
Sure. I'm Dr. Anna LaSota. If you come into the office, I will be Dr. Anna. That's how I introduce myself a lot. My husband is also a doctor, so he's usually Dr. LaSota. But I graduated from high school from Blue Valley North in Overland Park, and then I went to Pittsburgh State University for my pre-med for 4 years. And then I went to Kansas City University of Medicine and Biosciences up in Kansas City. So there I received a DO. And then I went on to Wichita, Kansas to do my residency for 3 years in family medicine. After that, I did another year of full practice family medicine at Grace Med in Wichita while Ryan was finishing up his sports medicine. And then we moved to Emporia, to Newman Regional Health, and we've been here ever since. The reason that we decided to come to Emporia initially was because of the location. My family is still up in Kansas City area. Ryan's family is down in the southeast area near Pittsburgh, Kansas. And so we decided to kind of come in the middle of the two. And then Ryan also had the great opportunity to work with ESU, and he loves that. So it's been just a great place for us to be.
You guys have been here since the beginning, right?
Yes, we have been here for 14 years now.
Wow.
Yep.
Yeah.
You just green when we came out, that's for sure.
You helped start the medical partners.
We did.
Yeah.
So Dr. Heitman and Dr. Esau had come the year before, and then we came right after that.
Awesome.
So, yeah.
Wow.
It's crazy to think that we're the old ones now.
It's a great team.
It is a
Yeah.
great team, I would have to agree. We're pretty blessed.
So how would you describe your approach to patient care?
I would say for my approach, I do try to take care of patients holistically. I try to learn about them, what makes them happy, what makes them sad, what they're stressed about, along with the symptoms that they're coming in with at the time. I think that all of that has a big, it plays a lot in our health overall and just how we feel from day to day.
That's
great.
Absolutely. Amanda, we're so
Yes.
glad that you're here with us today.
Thank you.
Yes, yeah. One of my favorite teamwork examples is right here, honestly, because when I first started, I remember coming in and I was like, wait, I always see her with Dr. Anna LaSota. Yeah.
Together for a lot of years.
For a long time.
Oh,
So
that's
good.
awesome.
Yes.
Well, it's a really great bond that I feel like we get to experience a lot. And I'm sure patients get to experience that too in and outside of the room. So having that primary nurse. But Amanda, getting to know you a little bit, can you share your role on the care team and what a typical day looks like for you?
Sure. So in my role, I am Dr. LaSota's primary nurse. We've been together for, well over 5, 6, 7 years now, quite a while. So we definitely know our patients very well. So a typical day for me is I take phone calls from patients, lots of medication refills, assisting her with procedures, giving kiddos vaccines. That's one of the many benefits in family medicine as we see kiddos, infants clear to geriatric, as well as prior authorizations for patients for certain medications.
Making sure referrals are completed.
Yes.
All of those types of
Yeah,
things. A little bit of
yes.
everything.
One of the things that I've really enjoyed is the patient portal too, and you respond so quickly on there. Amanda is very fast on the patient portal.
You know, I will be honest, because I've been a nurse for a long time, I was a little nervous about that when they implemented that, but that has actually been that is a blessing for patients, and it is very quick. We see that immediately when the patient sends it in, so we can either divert that to Dr. LaSota, or whether it's a refill, we can go ahead and get that taken care of and notify the patient. So yes, very useful tool.
So what inspired you to become a nurse?
Well, honestly, coming out of high school, I wanted to be a dental hygienist. And I was going to Wichita State and worked in a dentist office and found out real quick that's not what I wanted to do, but still wanted to provide care. And so then nursing became that option, and it has been a blessing ever since. So I'm very fortunate. And I attended Emporia State University.
And you spoke to a little bit about your relationship with Dr. Anna LaSota, but what do you enjoy most about working alongside her?
One thing about Dr. LaSota, she is one of the most compassionate, caring, genuine people I've ever met. So, and she definitely treats every patient as though they are a family member of hers. So, and that makes it very, very easy to come to work and provide care to patients.
I have loved getting to hear a little bit about both of you, not just as healthcare professionals, obviously, but as people. So it really highlights something important. Behind every appointment or visit, there's a relationship being built. Absolutely. So, and that's actually a perfect segue into what we want to talk about next. So the importance of primary care. Because having a regular doctor and care team isn't just about when something goes wrong. It's about someone who knows you, listens to you, and helps guide your health over time. So, Dr. Anna, let's start there. Why does having a primary care provider play such a critical role in a person's overall health, even if they feel healthy?
I think a primary care provider knows patients very well. We see them for a lot of different things. If they are ill, a lot of times we can get them in to see them for that and take care of those concerns. We will also see patients when they are healthy and feeling good. As a primary care physician, I get to know the patient in multiple different facets of their life, when they're not feeling great and also when they're feeling wonderful. And so when it comes to health in general, I feel like your primary care physician is going to know you. They're going to hopefully be someone that you can trust with anything and that you can be fully upfront with so that they can treat you to their best ability.
Yeah.
Absolutely. With that being said, Dr. LaSota, what are the most common health concerns that you're seeing from patients, maybe even today?
And I was trying to think about this as primary care and as a family medicine physician. I see newborns, I see geriatric patients, and everybody in between. So it's kind of hard to say one thing is common. I do see a lot of patients for their well visits and their normal screening exams. I do see a lot of patients now coming in, especially middle-aged women and men both, coming in with fatigue a lot of times. And fatigue is a really difficult symptom to kind of put your finger on and kind of figure out what's exactly going on. But we have been doing a lot of sleep studies lately for fatigue and finding out that sleep apnea does get underdiagnosed often. And so I think that's one thing that can really be a great tool for people or for physicians to figure out what's going on with patients. We are a very busy society right now, and so stress and just not taking time for yourself can be a big issue. And so I think stress and anxiety is another thing that we see often. It's not something that we always treat, but it's something that we a lot of times will talk about in the office too, especially if I know that patient really well and I can kind of tell there's something going on that's a little bit different than normal.
And we have, just for patients that might be curious, we do have sleep study abilities here at Newman. So we have sleep rooms you can come and stay in, or there's equipment you can take home.
Yes.
So, and it takes a provider referral, I believe.
It does, yes. But it is really nice that we have the option to do an in-home sleep study, or if we need it, we can do it in the sleep lab. And so I do think that's really nice to have in the community.
Yeah. Yeah, that's great. Switching gears a little bit, I just want to ask about preventative care. It's talked about a lot, but what does that actually mean for patients?
So preventive care is care that basically prevents disease from happening, or we find disease before it's actually happening. So this would be checkups that people need to have, even if they're feeling healthy, certain screenings that are recommended by our governing bodies. So the USPSTF is one of the governing bodies that recommends certain testing at certain ages. And then it also recommends how often you need to do that in order to screen for cancers. So primary care physicians usually are very good about that and making sure that you are up to date on everything, or at least giving you the recommendations. It's not my body to tell you that you have to do something, but I'll give you the recommendation and then you can decide, and then we can order what we need to. So things like pelvic exams and pap smears, colon cancer screening, breast cancer screening, lab work even, coming in and having your blood pressure checked is actually a preventive measure, BMI evaluation when you come in. So all of those things that you do when you come into the doctor, those are preventive measures, and we're looking at those when we see you. We may not address every single thing at that time, but those are preventive measures that we're looking at to hopefully keep you healthy.
Yeah, that's great.
So almost every visit, you'll pull something, or
Yes, every visit there's information data that we have, and it's notated, and we can always look back at it too if we need to, which is really nice in primary care.
And then also having that ability with the specialties.
I was going to say, in primary care is kind of the hub of medicine, and so a lot of times we're asking for records from other hospitals to make sure that we have the patient's most up-to-date screening exams so we don't have to repeat things. Also, if they do see a physician that is in Newman Regional Health Medical Partners, then I can see those notes real time. So cardiology notes and orthopedics, general surgery, which is really nice. So we don't have to go digging and looking, but then we update when your last colonoscopy was so that you don't have to remember those things. That's what a primary care doctor is for. We are kind of like your medical hub.
We talk about continuity of care, but to kind of think about how quickly you can get that information right here in the town that you live in, and you don't necessarily have to travel for all of that. So.
Right. And a lot of times too, when patients come in for their wellness exam, that's something that I try and update to in the chart, is make sure that they have all their screenings, but then also ask if they've seen a specialist since I've seen them last.
Well, going off of that, what screenings or checkups do people maybe often delay that shouldn't be put off?
I would say colonoscopies.
Yes, I would totally agree. And colon cancer screening has changed the age. So it used to be 50 years old, and now it's 45.
Wow.
So usually what we'll recommend is a colonoscopy for the first colon cancer screening. And then after that, if it's normal, then we can move on to Cologuard, which is oftentimes covered by insurance. But yeah, it's at the age of 45 now. And they have decreased the age recently because we've seen a lot of younger people with colon cancer, and it's pretty aggressive. And so if we can get it, find it early and get it taken care of, it's going to be better. I would say mammograms and PAPs usually are pretty up to date. PAPs are only every 3 to 5 years now anyway, and so that's kind of nice. We're also looking at, there's might be some changes coming along with that too soon. It still may be 5 years, but just how we order the testing may be a little bit different. But mammograms are usually yearly, and usually women are pretty good about coming in. But they do start at the age of 40, and I don't know that everyone knows that. So.
Okay. And when does usually a pap smear, when is it recommended for?
At the age of 21.
21. Okay.
Yep.
And I think it's important for people to know that, you know, a mammogram and a colonoscopy, the screenings, those can save people's lives.
They can,
and so,
for sure.
yeah.
And they're usually covered by insurances pretty well. The preventive exams and screenings are usually covered by your insurance.
Yeah, yeah, good to know. So I'm curious, what makes New and Regional Health Medical Partners a great choice for individuals and families in Lyon County? And I know you even see people outside of Lyon County too.
I think it's the culture that we have. I love the teamwork that we have in our pod for sure. We have another nurse that works along with us, and our team is fabulous. It's wonderful to come to work every day. I feel like our team really makes patients feel like they are family and really takes care of everybody equally too, which I pride myself in and pride our team in.
And we've worked together for a while, so we really do know our patients well, know each other well. So if a patient does call in, we can typically tell if they're a little off too. And
Yeah. I also think the providers that we work with too are amazing. So we have a lot of new primary care actually just over the last few years, and we are so blessed. They're amazing. Dr. Tennyson, Dr. Bates, Dr. Diaz, Dr. Simmons,
Even our
nurse practitioners,
Yes.
Amy Seamers and Paige Kitzman. I just feel like they are really down to earth, genuine people. They want to take care of the whole person, which is wonderful. And I feel like the care that you can find here is top notch. It's something to write home about.
Yes.
Like we have some smart physicians for rural Kansas, which is great. Yeah. I also feel like our specialists are wonderful, and there's not a lot of small towns in Kansas that have cardiology and orthopedics right here, and general surgery. You don't even have to go anywhere to get your colonoscopy.
Right.
I mean, just
Right here
you're
at
right
home.
at home. So I think, and for me to be able to see all of that stuff, or your primary care physician to have all of that right here, I think it's just fabulous.
Yeah.
We're very lucky.
Yeah, and as a
in this community.
nurse, I feel that we're very, very fortunate that we can just call up that Dr. Lloyd's nurse and speak to them directly if the patient is seeing cardiology, and we can have a very timely answer for the patient if there's a concern going on.
Yeah, that is true. I send a lot of messages to cardiology, general surgery, ortho, just to ask them questions. I called Dr. Willis the other day to ask him a question, and he saw a patient for me real quick. Like, it's just that bond that we have between not just primary care, but also the specialist is really nice. It's a great place to practice medicine and then also be cared for, I feel like.
Yeah. And how reassuring it is to hear Amanda say, I heard you say just a little bit ago, but you had said that when a patient calls in, you can kind of hear when they're off, if they're having an off day. I really feel my primary care provider listens to me, but how touching it is to know that my nurse is also going to listen as well, and to be able to read those cues on when I'm off. Yeah, I have chills talking about it right now. It is touching to know that, like, I know people in my life will read when I'm off, but to know, my primary care provider, of course, will, but to know that the nurse that's in the room with me also pays that much attention to me.
Yeah,
I know that means a lot to people.
When you call in, and I know that she can tell somebody's voice, or if somebody's short of breath on the phone, she can tell, and she can know exactly where to send them. It's pretty awesome.
Both Sailor and I are from big cities. I think both of us have been so surprised and also just incredibly pleased with our experiences here, with getting to have a doctor that we feel like cares about us, knows us, we're not just a number, but then also that relationship with our nurse as well has been huge.
Absolutely.
And
as a young female in our community, continuing to build life and find Emporia home, it's reassuring to feel that in my community and know that I could build my family here and know that we're taken care of. And so
good.
Yeah.
I'm excited that you guys feel that way.
Yeah. It's awesome. We love Emporia.
It's real. It's very real.
Well, I'm from Overland Park too. So I initially grew up in Salina, but moved to Overland Park when I was 11. And so I agree with you. Medicine in Overland Park is a lot different than it is here. Not saying that it's bad, it's just different. My mom actually commented she had come down here to see a doctor one time. It was not me. She does not see me. But she's like, I got to go get my lab done. I got to get my x-ray. All of it was done in the same day. And I was like, that's normal. What are you talking about? She's like, oh, no, not in the big city. Like, we have to go schedule our lab, schedule our mammogram for later dates. And so
probably
I think
in a different building.
Yeah, exactly.
Different part of town.
Yes. And so I think that's the other thing too, is when you come to the hospital, you get a lot taken care of that day if you are able and have the time.
Yeah. Before we keep going, I want to talk about something I think almost all of us have done. I know I am in this camp. So maybe you feel a symptom and you grab your phone and suddenly you're 10 minutes deep into Google wondering if you should panic or ignore it. So we do live in a time when there is so much medical information available online. Some of it is helpful and some of it is completely confusing, and some of it honestly is a little scary. So I'd love to talk about how patients can use that information wisely and why having a trusted doctor and care team really makes all the difference. Dr. Anna, how do you feel when patients come in with questions based on what they've read or seen online?
So I do think this is very common, and I don't blame people. I mean, they want to figure out what's going on. I think that that's completely fine. But I would say when you type something into the computer, you are looking at one symptom or two symptoms. You're not looking at the whole person. And so that's where a doctor can come in. So when you come in my office and you tell me that you found something online, great. I will say, okay, tell me what you found, and then we'll talk about it more. But then I'm going to ask you to explain your symptoms to me. I need you to be honest, upfront, open, and give me everything that you can. And then I will continue to ask questions that lead me down different differentials in order to make the decision on what is potentially going on and what is potentially life-threatening that we need to figure out now, or this is not life-threatening, you will be fine, let's do something like a little bit of lab work or an x-ray or whatever in order to figure it out. But that is what I went to school for. The amount of diseases that we learn in medical school, you can only imagine. And so that's what we are able to do, is kind of decipher if these things are going to be a problem or if we need to do more evaluation. Just be upfront and honest, and try not to get annoyed when your doctor asks you a lot of questions about what's going on, because most likely their mind has all of these file cabinets that they're going through, and they're trying to get it narrowed down to just one thing or a few things in order to give you an answer about what's going on. And the computer can't necessarily do all of that.
Right.
It's called the art of medicine.
Yeah. It is an art.
Yeah.
That's a really neat visual to think of, like filing cabinets in your mind.
So there's a saying that primary care doctors know a little bit about a lot or everything, and specialists know a lot about a little bit. And so even if I can get started down a path and figure out some of it, then and if I need to send you to a hematologist, then I'll know when that time comes. Like, I need to send you on because they're going to know better what we need to do here.
Wow.
Yeah. Well, with that being said, with so many influencers and different ways of media, online ads, what do you think, Dr. Anna, the biggest risks of relying solely online for medical advice without consulting a provider?
I think it is finding things that may not be exactly what is going on with you, where you can put a couple symptoms in and get to a disease, and then that is not actually what's going on. There's probably more to the picture, more things that we need to ask and talk about in order to either make that diagnosis or go down a different route. And on the computer can't always do that. It only takes a couple symptoms and then points you in one direction.
I mean, I think that a lot of people do find themselves being recommended supplements or various other, medical advice. Online. It's hard to navigate.
It is hard to navigate. And that's the other thing. We have even had a lot of patients call and ask, and I'm okay with that. I welcome those phone calls. We had a patient just the other day ask about a new cancer screening exam. I'd never heard of it, so I called Dr. Wazir and asked him, and he gave me his recommendations on what we need to do with that type of testing, and is there a better option? And so if people do have questions about supplements or advice that they have found and they want to know more, the portal is a great way to do that, because then we could get to the question, we could answer it once we have an answer for you. And so I think that I would welcome those questions rather than people spending a lot of money on something that doesn't work or it does cause a problem for their health. Yeah.
So that kind of leads us into this next question, but just what is the best way for patients to start that conversation with their provider about things that they've seen or read online?
Honestly, calling in, I think coming in and visiting with Dr. LaSota one-on-one is always a great place to start, or utilizing the patient portal and, once again, because she will always research whatever is asked of her. She will always research that for a patient too.
And a lot of times in the room, I'll pull it up online and we'll look through it together and see exactly what's in it or what, if there is any FDA approval. That's the other thing is I try to be evidence-based. And so a lot of the vitamins, minerals, supplements are not FDA approved just because that's not what they do. And so it's hard for me to say yes or no, but if it helps someone, I'm okay with it as long as it's not going to hurt them. And so that's the other thing. I also look through their medications and make sure that they're not going to counteract anything that they're already on or make a bigger problem with some of the medicines that they're taking or some of their diseases that they already have.
It can be embarrassing to admit that you looked up something online or you saw it online. And so I think that is definitely a barrier.
I wouldn't be embarrassed by that. Our phones are readily available, and people, you get nervous when it's your body and there's something different. You don't know. And so it's okay to look things up. Now, I would say definitely do that judiciously or, like you said, if you have a question, talk to one of us. It's okay. I wouldn't be embarrassed by it. I would just know that we might have some different recommendations for you, and I want you to be open to that and okay with that.
Yeah.
But the way that social media and ad and influencers are right now, I don't blame people for looking, especially when it's something that's different than normal.
Yeah.
And I definitely want them to have a trust with the nursing staff, definitely, that they can feel comfortable calling and asking at any time.
Yeah.
We don't want them to feel uneasy or embarrassed whatsoever. That's our job.
It is our job.
Yeah.
And what a vital role that the both of you and our primary care providers and the nursing team play in our healthcare journey, in your own personal healthcare journey. You guys play such a vital role. You can hear that in the discussion today. So thank you. Thank you for that. Before we close out, we'd love to just learn a little bit more about the both of you, maybe behind the white coat, behind the scrubs. Get to know you guys a little bit more. Dr. Anna, what is one thing about you that patients might be surprised to learn?
I love to bake, and I have always really loved chickens, and I have wanted chickens, so we moved not too long ago, and we have some land, and we have yet to get chickens. But we have cats and dogs, and they end up in the house. And so I think my husband thinks that the chickens are going to end up in the house. And so he's like, nope, we're not getting chickens.
Let us know when the chickens get there.
I don't think they'll get in the house, but still, we are.
That's fun.
Haven't gotten chickens, but I love just looking at them. They're hilarious. Anyway.
I love that.
Yeah. Amanda, what about you? What's something that our listeners may not know about you?
That I have 2 daughters that I chase around still, and my oldest is actually following in my footsteps and is in nursing school now.
That's awesome.
And our family, we love to show cattle. That's something that a lot of them would not know.
So I also have 2 children. I have a boy and a girl, and they are extremely busy in every activity you can imagine. So I am a lot of times carting them around, making dinner for them at all different times during the evenings. I do love to read. I like to garden. I like to be outside, but I also just like to hang out inside and read a book. So
Well, Dr. LaSota, also, I know that you're involved so much in the community as well, on different committees.
I'm very busy.
Yeah.
Yes.
We appreciate you being involved. And I know it deals mostly with the kids too, your kiddos. Yeah. That's sweet to
Euphoria
see.
Energy. And then I am on the steering committee for the rec center too, which I'm very excited about. And hopefully that will start picking up, but we'll see.
Okay. And we'll kind of wrap this up. What's one small habit that can make a big difference in someone's health?
Okay, I have actually thought about this, and one of the things that I think is going to be helpful for everyone is to make time for yourself and make time to actually take care of yourself. So when I say that, it's yes, making an appointment for your wellness exam every year. Make sure that you're up to date on everything you need to be up to date on. But also, like, get up from your desk and go fill your water cup and come back. You need to drink water every day. If you have an alarm in the morning, set an alarm at nighttime. That's what time you go to bed. Stop scrolling, put everything away, go brush your teeth, wash your face, and go to bed. Like, just making efforts like that can really keep you healthy. Also, stress relief. If you are somebody that is doing so much all the time, you have to take time for yourself. Go check a book out at our public library. Our public library rocks. It's amazing. It's cozy. It's warm. It's like walking into a huge hug when you walk in there. If you are at your kids' softball practice, walk around the field a couple times. Don't just sit there and watch. It's okay. They'll be fine. Take some time for yourself. Make like extra steps, getting water in, those things. It doesn't have to be something that you just take extra time out of your day. Do it with everything else you're doing, but make sure to take time for yourself.
That's great. Yeah, absolutely. If someone is listening today and maybe hasn't seen a doctor in a while, what would you want them to hear if they had the opportunity?
I would want them to hear that doctors are real people. We want you to trust us, and we want you to understand that coming to see me is not scary. I hope anyway. I want to have a conversation. I'm not going to push you to do things that you don't want to do, but I will give you recommendations. But just that we're real people. Come in and see us so that we can make sure that you're healthy and live a happy life.
Okay, and any final advice on taking the first step toward a better health?
Just make the phone call.
Agreed. Find a good primary care doctor and just take time for yourself.
Thank you both so much for taking the time today to share your wisdom and yourselves with our community. We are so grateful for all you do, truly. You serve our patients and you make a huge impact to our region, so thank you so much. Thank you to our listeners for joining us for this episode of The Healing Voice. We hope today's conversation offered helpful insight as you work toward better health.
If you've heard something that you'd like to learn more about, we encourage you to reach out to your primary care provider. They're your best partner in making informed decisions about your well-being. Be sure to tune in next time as we continue sharing trusted guidance from the experts who care for our community. Together, we're committed to helping you achieve your healthy goals.